Better screen. All right. Hey guys, welcome back to my channel. And if you're new here, welcome. My name is Sadani, and this is the first installment of Health Culture. Health Culture is a place that I created on different virtual platforms to talk about problems in the Black community, especially with health. And this goes into different topics, whether it's mental health, reproductive health, just chronic diseases in the Black community, and also talks about relationship health. So health culture is for the culture and it talks about health. So overall, this is my first installment. So please bear with me if I sound kind of nervous. I did a original audio recording about health culture and all that it entails on my Clubhouse. So if you are on Clubhouse, you can follow me at Sadani, Cydanni. You can find me there. So today I want to talk about patient advocacy and definitely talk about patient self-advocacy and the importance of it. If you see me looking down, I got some notes here that I wrote down, and I'm going to be kind of looking at my notes back and forth. All right. Okay, so patient advocacy. Patient advocacy is where a patient has someone fighting for them in a healthcare system. Basically, anyone or any entity or agency that's fighting for a patient's rights, their health, helping them understand their billing as well, that can be a patient advocate. The actual definition is any activity that ultimately benefits a patient. So patient advocacy can come from the government, it can come from a nurse, it can come from a doctor, can come from a caregiver, overall, any agency or group that helps patients get their voice heard in the healthcare system. The importance of having a healthcare advocate or a patient advocate is that a lot of patients, especially those that are elderly, those in the Black community or communities of color or immigrant communities, they do not have that communication with a doctor that will benefit them in and helping them in their health. So they may not be able to communicate their symptoms or their ailments or anything that they're going through, or they may not be able to understand their doctor as well, therefore causing a health disparity. And a health disparity is when there is a gap in healthcare for the patient. Overall, like I said, the communities that I mentioned, these are communities that are less likely to get proper help because of health disparities. So the reason why patient advocacy is important is because it gives patients and families direct, customized assistance in navigating the healthcare system. A healthcare advocate role entails helping patients access healthcare and educating patients so they can make well-informed healthcare decisions. So basically, if a patient understands the whole system, if a patient understands their diagnosis, if a patient understands what doctor they're seeing and why, and their symptoms, they can make better decisions in regarding their health, therefore helping them become healthier in the long run. So the impact that patient advocacy has on patients is health advocates can play a critical role in explaining health information to patients, helping them make informed decisions about their health by minimizing the communication gap between healthcare professionals and patients. Healthcare advocates are key in improving health outcomes. So today, I really want to talk about health. I want to talk about patient self advocacy. So, not just patient advocacy, because a lot of these patients, they may not have a connection to a healthcare professional. So, being an advocate for yourself as the patient and why that's important. So, self advocacy is when the patient makes an informed, educated decision about their health for themselves. And I'll give you a little background story as well a little bit later. So, patients that can't access a patient advocate, when they make decisions for themselves, it actually can improve their health even better than probably an agency or government agency, social worker, nurse can make for them, because them themselves, they understand their body. So a little bit of history on patient advocacy is patient advocacy is more needed now than ever because of the climate of the healthcare system. Due to like the pandemic, a lot of people are not receiving adequate health care. There are already people that haven't been receiving adequate health care anyways, just because the healthcare system, especially in some neck of the woods, are not up to par. But after the pandemic, a lot of doctors, a lot of nurses, anybody that work in the healthcare industry, they're overwhelmed and overworked. A lot of them are doing the best they can, but because of the situation, um, they are just stressed out. And when anyone's stressed out, even if they're in the healthcare system, they may not be following the proper protocols. They may not be getting enough sleep. They may not be treating their patients correctly. So, once again, there may be some mistreatment, misunderstanding, miscommunication, and it could be on either part that creates um, further, it just acerbates the illness even more. It creates I guess, a more of a gap in receiving proper health care. So before the 1970s, they had a lot of doctors coming to homes and building a relationship with their patients, doing checkups. They were well known in the town. If someone comes into your home, like a doctor, you'll probably have the opportunity to talk to them and build a relationship. Most of the time, these doctors were the same doctors in their family as well. They were the doctors that treated their uncle. They were the doctor that treated their mom or their kids. It was just pretty much a family doctor that made house visits. Once again, building a connection and a relationship with their doctor, and also helping them understand their elements and helping the patients understand how to connect with their doctor to get the best help. So after the 1970s, a lot of just house visits stopped. Now in our modern society, we have telehealth, but even that is like, to me, what can you really do through telehealth except just make a conversation and tell the doctor you need a refill? So even with telehealth now, I feel like that's just going to increase the gap of healthcare even more. Adequate healthcare to those that need it the most, especially those in certain vulnerable communities. So after the 1970s, the building a personal relationship with your doctor has become less and less. And I personally feel that it's really sad because there's people that are just really sick and they're not getting the proper help they need. So I'll share a little story. I know a woman that went to the doctor and got admitted because their pressure was really, really high. They have hypertension and their blood pressure is really high. So they also have diabetes and their sugar tends to run really low because they're changing their diet and they're taking this medication that is taking even more sugar like out of their bodies, therefore making their blood sugar even lower. And one thing that I noticed is that this patient was saying that since they've been in the hospital, I mean, their sugar is going higher and higher, even more higher than it was when they were at home. And I said, "Oh, what is the doctors? Well, not doctors, but what are they feeding you at the hospital?" And she goes on to say that they're feeding me cake and grits and all sorts of stuff, I guess, to just raise her sugar, but unbeknownst to them, her sugar is literally going up even higher and she's upset. And I told her, I said, I don't think you really should be upset at the healthcare system or the hospital cafeteria or whoever's giving you this food. You should really consider not eating it. If you get something from someone, you do not have to eat it. If you know that this cake has a lot of sugar in it and they're giving it to you because that's just part of their protocol and the food that they give their patients, you can't be upset with the healthcare system for that. You have to take it on to yourself and be your own self advocate and think and say, should I eat all of this cake? Which the patient did end up eating all of the cake that day. And once again, her sugar went up. So that's how I see self advocacy in a whole. If the healthcare system is saying, I need to put you on these pills, that pills, these pills, that pills, and they have all of these side effects, and also have all of these like connections to it that's actually making you worse in your perspective, you need to do the research as a patient and ask the right questions and look up what the side effects really mean and how to avoid it, how to get off the medication, how to communicate with your doctor on maybe switching a medication or lowering your dose. So, this is another form of self advocacy, just like the patient that has the high blood pressure and the low sugar that is now getting higher in the hospital room. Um, you don't have to eat it. Now, I am not a doctor. So I definitely believe to take the recommendations of your doctor. However, at the same time, I think that using common sense and using research and communicating with your doctor to let them know the side effects that you are having, and almost like you have to negotiate with your health a little bit, because yeah, these doctors have went to school for years and most of them know more knowledge than we do. However, we're still human and we still have a body. Every single body is different. You can have two patients with diabetes and they both have type 2 diabetes. They both have the same diabetes um, for over, let's say, 20 years. And they're both eating the same diet and the diabetes affects them differently. Everyone has different genetics. However, what I'm experiencing at these doctor visits or just in research in general is that a lot of doctors are diagnosing or giving you medication or according to the lump sum of research that they've done, or maybe the lump sum of patients that they've seen, not realizing that there's outliers. If you've taken statistics, you understand that sometimes there may be like a few outliers in the distance that do not make up the overall statistic. So if you're seeing these patients and they are just in general like, oh, they got diabetes, let me just give them metformin. Oh, they got diabetes, let me just give them this. And they're not saying, okay, this person, they took these pills and now they're complaining about this and that. Instead of just chucking it up to side effects, maybe taking the time to really listen to the patient's side effects, listen to how it's affecting them, and lowering the dose or changing the medication. That's another reason why it's very important for patients to speak up, patients to self advocate for themselves, to give themselves a fighting chance. Because, like I said, I am not a doctor. I have my master's of public health. So I am an advocate for health for sure, but I'm also an advocate for just self identity in health, knowing who you are in your health journey. So now I'm going to talk about another reason why patient advocacy, especially self-advocacy, is really important, and how to be a patient self-advocate. So let's say that you are heading to your appointment. The best thing for you to do is make sure that you're heading to your appointment on time. If they're giving you documents to fill out, make sure you're filling out those documents beforehand if you can. If you cannot, make sure you get to your appointment on time, at least maybe like 15 minutes early. That way you can fill out this documents. That way, if you need help, especially if you may have some type of literacy issues, you can ask the people at the front desk to help you fill out the documents. When you arrive on time, make sure that you also arrive appropriately, looking clean, groomed. Make sure you take a shower and make sure when you get to your appointment and fill out the documentation, you have a list of symptoms you may have, side effects from any medication, anything that you've been going through. Sometimes these doctor visits are a few months in advance, and there may be underlying symptoms you're feeling and you forget because it's gone the day that you actually get the appointment. I remember I had a really bad earache, and it kind of went away by the time I got the appointment, because I made the appointment, let's say January 1st. I got the appointment February 1st. So by then the earache is gone. However, I do know that this earache comes and goes. So it may not be there the exact day when they ask you, hey, how are you feeling? You're feeling fine at that moment. But a month ago, you're noticing that this earache is pretty much chronic. So write down your symptoms, keep a small journal. Doctors love when they see that you're taking the a good step forward. Just like anybody, if someone is taking a good step forward towards their health, more than likely they're going to work with that patient more than someone that comes in there late, paperwork's not filled out, On top of that, they're on government assistance, and they're not looking and smelling their best. They're going to be like, oh, why am I going to spend the extra 5 minutes explaining them something that they probably don't even understand? Also, why am I going to take the extra 5 minutes to really ask some questions and investigate into their health when they don't even look like they care? Now, from what I know and what I hear from the doctors that I know personally, they say that if a patient comes in there smelling like weed, looking a mess, looking crazy, there may be some biases. I've also read a study about that when someone has liver disease, sometimes that there has been a bias towards that person with liver disease, especially if they've been an alcoholic all their lives. Now, this is not every healthcare system and this is not every doctor, hear me out, but I'm saying that doctors and the healthcare system, other professionals in the healthcare system, they are just like us. They're human. They are not like exempt from making judgment or bias about someone, especially about their appearance and making the conclusion with them. So just like anything, you want to make sure that you are looking your part. Don't got to be a three-piece suit, but you want to make sure that you're looking as best as you can when you talk to these doctors. Make eye contact. I know in certain cultures, making eye contact is a sign of disrespect, maybe even a sign of challenging them. But from my understanding, unless it's against your culture, make eye contact with the doctor. When you're speaking, speak up. You are advocating for your health. Now, my health is almost the most important thing to me in my life. Pretty much it is up there. Maybe there may be like one or two other things that are that important to me, but my health is so important to me. It is so, from a young age, I vowed to be healthy the best I could. But at the same time, I know that that's a journey. Like sometimes you could be as healthy as you want, but things still happen. We're life, we're mortals, you know? But one thing that I do know, if you are interested in becoming healthy, if you are interested in becoming a self advocate, you have to do the research. You have to make the eye contact. You have to come on time. You have to build a relationship with your doctor. You have to take note of how you're feeling. This is very important to get results. Anybody that does stuff 50% and not the full 100%, you're going to get 50% results. These doctors see thousands of patients. Their schedules are constantly booked, especially with the current pandemic. And it's one thing to just do the borderline, baseline healthcare, like, oh, let me check your ears, let me check your reflexes, breathe in, breathe out, whatever they do with that, the normal primary care checkups. And it's another thing to really investigate. A lot of these doctors are not going to do all of this investigation unless they're a specialist, or maybe they're just personally interested in that. But they may be if you put your good foot forward. So, in a nutshell, that's patient self advocacy, and the importance, especially in Black communities, people of color, and immigrant communities, especially if your English is not your first language. If you cannot find a patient advocate in your healthcare system through your insurance, through the government assistance, then you have to be your own advocate. If you be your own advocate with all your appointments, within a year, you will become better. I know that for a fact. You will be better. You will increase in your health because you're taking pride in your health. So overall, that is a nutshell. Let's see, did I forget anything? Oh yes, there's a few things that I wanted to add as well. Let me see. Okay. So the few things I want to add to that is, if you are a patient and the doctor says, oh, I need to do some labs, and you never heard anything back from them, most of the time from different healthcare systems, that's because there's nothing wrong with you. There's nothing that came up in the labs, I should say, that are of importance. So they're not going to call you. However, if you're feeling something and you're curious, you have to take that initiative to call either the lab or call your doctor, look on like the telehealth system through a portal, and find out what those results were. Print it out and put it in a binder that says medical documents. This is another way to keep track of your health. Sometimes doctors may not call, like I said, if they haven't didn't see anything, and sometimes they do see something in the lab and they may forget to call. Once again, they're human. You have to take the initiative. If you have medication or something at the pharmacy and you forget about it, they may not call you. They may not call you and say, "Hey, Mr. Jones, this is ready." So follow up with your doctor, follow up with the pharmacist, follow up on your labs. This is another way to be a great patient self advocate. Okay, let's see. Did I forget anything else? Um, Ask a lot of questions. It's very important to ask a lot of questions about your health. I'll share a quick story. I went to a doctor visit, and I started asking a lot of questions about, it was a different doctor that I went to for not my primary care. And they were like, what are you or something, a doctor? And I was like, oh no, I'm a public health professional. And they're like, oh wow, a lot of people don't come in here and even ask anything. And I was just like, so they just let you do these procedures and they're not batting an eye. They're not asking any questions. They're letting you do something to their body or put something on your body or put something in your body. And they're not even asking any questions. He said, no. He said, you're literally, I can count on my hand how many times someone has done that. And I was just shocked. So once again, that's why I want to do a video like this. Make sure you're asking questions. You may not know the right questions, but as you start to do research on, let's say that you have a procedure, let's use the air again. You have a procedure on your ear coming up on the 5th, and it's the first. Start typing in what the procedure is on Google. That's a way to start. Now, if you see, oh, this procedure involves this solution or this chemical or this, this aftercare afterwards. Okay, that's something to ask. Say, hey, write down a few notes after you're doing your little Google research and bring it with you. Like, hey, what's in the solution? How long does it take to heal? How long does it take to recover? And if I do this, will it hurt the procedure? Things like that is great questions to ask even before you arrive at your appointment. But if you don't get the chance, ask during your appointment. When I asked this doctor questions about the procedure he was going to do on me, it made me feel less stressful. People say that the dentist office is the most stressful, like hospital appointment or medical appointment. But I personally think that like any appointment can be stressful, especially if you're not informed and you're not kind of like already knowing what to expect, or if you're not asking the right questions or even communicating with your doctor at all, then hey, any appointment can be scary. So once again, it's important to do a little research, talk to your doctor, especially if it's any type of procedure or surgery. All right, guys. So that's my whole patient self advocacy in a nutshell. I'm going to be diving deeper into these topics. This is Health Culture's first episode on YouTube, but like I said, I've done the first episode on Clubhouse as well. So if you really, really like this type of content, please like and subscribe. I got other topics that I want to talk about in my health culture series that I eventually want to make into a podcast as well. So I want to talk about the healthcare system. Are they after your pockets or saving your life? Also want to talk about type of doctors and which type of doctor that you have. And I'm not talking about like, do you have a gynecologist or a primary care doctor, but meaning their personality types. There are some doctors that have like a alpha type or beta type personality. So I just want to talk about that as well. It should be pretty fun. Understanding your diagnosis so you can maintain your health or cure yourself. Patients speak up. That's another topic I want to talk about coming up soon. So I have some great ones. And this one is, I can't wait to pull this one together. This one that I want to talk about are feminist ideals affecting your health, a closer look at liberation and wellness. And I mean, I can feel like I could talk about it right now, but I'm going to pull some more notes together for that coming up. So please subscribe if you really like this information. You can follow me on Instagram at Sadani, Cydanni. You can find me on Twitter as well underneath Sadani_. And I'm just excited. I'm excited about sharing my experience and research and my love for health, especially with vulnerable communities. Okay, so please like, comment below, and I'll see y'all next time.